Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
Vinca is a 1988 model bird, so 27 years old, that presented fairly healthy. These birds have a tendency to get kind of fat. The Amazons, that's very common in these guys, especially if they eat a lot of peanuts. And so this bird has a huge mass on the sternum. This is called the sternum, where the bone is right here, the keel bone, and then alongside and underneath here. So the bird is really fat, but then has this big fatty mass here. But we have to take it off and send it in for analysis in the lab histopath. So our intent today is to get this off, shell it out, send it in, close up the incision, and then figure out exactly what this is. If it's a tumor that's cancerous, or if it's just a lipoma, which is benign mass. So we put an endotracheal tube down into the trachea. They don't have an epiglottis, they only have a glottis, and it's right at the base of the tongue. So we're delivering oxygen and anesthesia, which is isoflurane, directly into the trachea. Taking the feathers off now, preparing the surgery area. We pull the feathers instead of shaving animals' hair. So we actually pull the feathers right out at the base. So in birds we have to work super fast because we want as less time under anesthesia as possible. And then we're getting EKG and blood pressure hooked up so we can monitor the bird. EKG is going, blood pressure is very stable. So heart rate is around 350. And right now she's got the skin open and she's trying to shell out this mass. Let's get this off.
Okay.
Yeah. So we're trying to debulk it as best as we can. Take a liver biopsy because the liver looks pretty bad. There we go. Got a piece of liver. Good. 160 blood pressure. Heart rate 350 still. Stable, but at least it looks like hepatic carcinoma, the liver, which is typical in these older birds. So now she's suturing the abdomen and skin together. You never know what to expect in a bird because you see a fatty mass that appears to be on the outside of the bird. The only way we would have known is by taking a CT scan, and most bird owners don't have money for those types of things, so we got to do the best job we can. And birds very rarely mess with their sutures, so we put in continuous sutures with absorbable right through the skin. And we're done with the sutures. Now we'll give them the pain medication. So there's the closure of the abdomen. And it was actually a big mass within the abdominal cavity itself instead of just being external. And then she's got the Baytro to put in there too. Yeah, blood pressure is still 130 systolic. And heart rate is 350. She's using a butterfly to put in the fluids, sub-Q fluids, that she's giving on the side of the leg right underneath the skin. They're warm fluids. Just take that up. He's waking up. Take the cuff off. Keep him warm. That liver biopsy, Chad, goes in formula. And then we're going to warm him up in the incubator. All right, there you go, buddy. Now he'll go back into his incubator and lay on his back until he wakes up. We'll let him wake up by himself, which will take about 20 minutes or so until he's up and standing. And then once the bird is standing, we're going to want to offer food right away. Sometimes we have to tube feed.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world at our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. HAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. HAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, Personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mugwanago, which boasts a fully matted 5,200 square foot training hall. While in Mugwanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
Today we've got Echo, the chicken here. Echo came in for a problem with her cloaca, which is the area that the eggs come out. She passed an egg, actually 2, I think one earlier this morning and then just another one recently, and then the owner noticed that she had a prolapse, which just means the back end is kind of sticking out. So you can see it quite clearly where the red is. And so what we're going to be doing is sedating and taking an x-ray to see if there's any more eggs inside her abdomen. And then once we know that, we'll go ahead and suture the prolapse back to in the right place.
Oh, you're a good little chick. Do you want me to sedate her a little bit though?
I can give her some gas.
Okay, because she is like...
Nothing?
Alright, you good?
Whenever you're ready. So here's Echo's x-ray, and this is the area we're going to be looking for an egg, and there's nothing there, so that's good news. So we'll go ahead and we will do the purse string. And this is called a purse string suture, and it's just enough to keep everything tight. I'll make my last one. And this is the final here. We've got our purse string in place, and the cloaca is snug but not closed too tight to the point where we can't go to the bathroom.
What's going on with this guy? Hi, kitty. Hey. Hey, buddy. What's happening with him? He just came in this morning.
Oh, you are so cute.
Hey guys, I know you're taping, but my cat, he's got some problem. I'm gonna put him.
What's wrong?
I was just downstairs and getting ready to come in for my shift, and he started breathing really funny. And
Has he ever had any problems before this time?
Not that I've seen. Come on. He's breathing a little better now, but he actually collapsed.
Oh no.
So
We're gonna go get drugs quick.
Yeah, get some drugs for him
Yeah,
because he's
just
pretty.
to calm him
He's
down
really
because
upset.
he's really anxious.
He's really anxious.
Wow, he's really working hard, Michael.
Yeah.
Oh my goodness. Yeah, we gotta get the oxygen going. We got
He's
it up
really
to 8
upset.
liters per minute. We're gonna get him some butorphan on midazolam. So how old is he?
He's about 11, and
11 years old.
yeah, I tried to listen to his heart and lungs at home, but he was really upset. So
No.
yeah, so
And he's never done this before, huh?
no,
Yeah.
and I'm worried about him.
But you know how cats are, and Persians especially.
Yeah,
They get hypertrophic cardiomyopathy, which is a thickening of the heart, very common. It's a genetic predisposition of these cats, and they're silent actually. You don't even know anything going on. Even he's a doctor.
yeah, I didn't think
and
I'd have a problem with
there's
that.
no symptoms, nothing, because cats, you figure, just sit at home, they hang out, they really don't go outside, they don't do anything. So we kind of call it the silent occult hypertrophic cardiomyopathy. We don't know for sure if this is what he has, but because of the age, sudden onset of just breathing really hard and collapsing at home, we're anticipating that's what it's going to be. So
Be careful, Chad. He gets
we'll
really
do an
upset.
echocardiogram on him. We're going to give him a little sedation right now to try to calm him down because he's so anxious. We can get drugs into him.
Yeah.
We can give it IV. That's all right, buddy.
Yeah, I can feel his heart racing.
Yeah.
Yeah, I don't know what happened. I was just down there, and he just kind of got real
Well, lucky you
stumbly
didn't
and-
leave to go to work, you know?
Yeah.
If you would have come here, you would have maybe found him dead at home, you know? And that's a problem. A lot of people do that. They don't even know their cat has that. Come home and find him gasping for breath, or even find him dead at home. So that's the worst thing that can happen. And it's very frustrating because, you know, as a cat owner, there's really no test to determine that these cats have an underlying problem unless you find them breathing difficulty. You know, and people, you feel signs of sometimes not being able to go up the stairs, as many stairs as you normally did. Maybe your walks are cut shorter because you're feeling out of breath, or you feel some pain in your chest. And then dogs, we find that we take them out for walks and they don't want to walk as far, or they start coughing halfway through the walk. But cats that are indoors, they really don't do much. They only sit at home, so they just curtail their activity.
Yeah, and you know what? He's kind of a couch potato to begin with.
Right,
so
he's kind
I
of a
didn't really
fatty,
give a-
yeah.
Yeah. He's a little better as far as being relaxed. So let's go ahead. Just be careful. It can be a little bit of a.
Catheter is in.
So I'm gonna get Lasix. I listened to him, and he does have a heart murmur, by the way.
Oh, I
Never
couldn't
heard
hear
that
it.
before, no?
No, I never did.
And his lungs sound really harsh, so I think he probably does have cardiomyopathy. We're going to inject in a little bit of Lasix,
Yeah.
and then we're going to put some nitroglycerin ointment underneath his tongue.
Okay. I gotta tell you, when the shoe's on the other foot,
Yeah.
it's a lot different. I have to say my thinking is unclouded.
Yes.
Yeah, a little clouded right now.
This is his heart beating. And this is the aorta left atrium, and he's got a big left atrium, Michael, so he's got cardiomyopathy. We should get him on a Lasix, constant rate infusion. Obviously, you know that. And I'm benazepril, and we'll put him on phenylbendum.
Okay.
to help his contractility of his heart because he doesn't have SAM. And then we're also going to put him on that blood pressure medication and the benazepril, so we stop the remodeling, and you can call in a script, but we'll get him on the constant rated infusion of Lasix overnight, and then we should get some x-rays on him too. That's too bad, actually, because you never expect your own animals to be in that problem. We see it day in and day out, but it's hard when you have your own animals suffering, and all of a sudden you lose all. You know, he came running in here thinking, what is this, what is this? And of course, right away, as soon as I saw the breed and the age and the way the cat was breathing, and then heard the heart murmur, I knew what it was going to be. But it's a shock to the owner, even if it's a veterinarian. It's hard to deal with your own animal.
Well, he's sounding less congested, and really got to make sure this kitty pulls through. I had texted my daughter and told her what happened. She called me on the phone and I talked to her, and so I told her that with the proper medical intervention that he's got a pretty good chance, and we just have to watch him overnight. So,
because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I thank Mega and Dr. Dale Crescent for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
For over a decade, Fetch Magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
Butterscotch came in with a fluid on the chest, hard time breathing, came in from another referral practice, and we went ahead and removed fluid from the chest, and then took an x-ray several hours later. And here's the second x-ray. We did the first. The second x-ray has more lung field here, less fluid. And the cat is breathing better today, but we are going to try to go ahead and remove a little more fluid, see if we can make him more comfortable. So we are just prepping the patient up here. I'm going to just go ahead and clean this site. This is an iodine solution that we're cleaning with, and we're going to just clean the other side as well. So you can see the fluid that we're getting. This is all fluid from the chest cavity. There we go. So what do we have right now?
cc's.
Okay. And we'll try the other side. Ready? Okay, so we got what, a total of 24?
Yep.
All right, so let's go ahead and get him over the x-ray. We took the fluid off the lungs as much as we could get, and we did some follow-up x-rays. Unfortunately, we don't have a great outcome. The x-rays reveal some masses here in the lung. Unfortunately, this is a part of my job that I really don't like, having to deliver news like this. Unfortunately, there's not much we can do. This kitty's got 2-cavity disease. It's got fluid and changes in the thoracic cavity and then also in the abdominal cavity. We just called the lab and they faxed over the report. And it does indicate that it's probable malignant cancer. So I'm going to call the owner and let them know.
In the United States. No doctors, no dentists, nobody has to deal with euthanasia. It's coming. Believe me, it's coming. And it's a very important discussion that we need to have. And in fact, when I discuss it with most people that come in to euthanize their animal, they're like, I wish. Because they've seen their grandfather, they've seen their aunt have cancer, have Parkinson's disease, have some horrible disease that the people ask, I don't want to live anymore. But we can't even euthanize them. We have to watch them suffer till the last breath. And, so it's hard. But then the other side of the coin says, well, but then if you don't love that sister and you're like the one signing off, you're going to sign off the sister and you're going to all of a sudden be, euthanized. So there's a lot of controversy on the subject in human medicine. We downright have to deal with it day in and day out. We have to euthanize based on not on because the animal's suffering. I have to euthanize a 1-year-old dog because the people don't have money. I have to euthanize an animal that is the last thing that a woman has or a man has remembering their wife or partner or whoever it may be. This is it, and they have to euthanize. You have to euthanize a family pet with kids in the room. So a lot of sorrow. And the Humane Societies are euthanizing tons and tons of animals day in and day out. And I think men maybe can centralize it more. I think for a woman, it's a little bit more difficult. So I think it's going to be harder for us as a woman because we nurture. That's our primary purpose in life. And to keep taking that over and over, people ask me all the time, well, you euthanize every day, so you get used to it. No, you never get used to it. You walk in the rooms and you try to take away and you say, well, this is not your pet and you're helping this family through. So you try to make it, at least you try to make it such that you classify it such that it's good for this person. Or there's a person that really doesn't have the funds to do this. So you have to take it as it's better for the animal because the animal can't live any longer. They're going to go into bankruptcy because of the animal. So you have to think in that way too. But the sadness in the ones that should not be euthanized, it's always draining for a person and for a veterinarian.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.